Tuberculosis or TB is a serious bacterial infection caused by Mycobacterium tuberculosis. While it can affect multiple areas of the body, TB primarily impacts the lungs, resulting in pneumonitis or inflammation of lung tissue. The infection spreads through airborne transmission when an infected person coughs, sneezes, or speaks, releasing infectious droplets into the air. Once inhaled, the bacteria enter the bloodstream and lymphatic system, spreading throughout the body. The immune system responds by sending white blood cells to fight the bacteria. Plasma B cells mark the invaders with antibodies, enabling macrophages and T lymphocytes to recognize and attack the bacteria. If the immune system can't eliminate the bacteria entirely, it isolates them in granulomas, small clusters of immune cells, to keep the infection contained. This can result in latent TB, which remains dormant and asymptomatic until it is reactivated. Now let's look at the risk factors that increase the chances of TB exposure and infection.
Certain groups are at higher risk for TB infection. Crowded living environments like prisons, homeless shelters, and college dorms create conditions for easier spread. Foreign travel to areas with high TB prevalence, such as parts of Asia, Africa, and South America, increases exposure risk. Additionally, individuals with compromised immune systems, including those with HIV, patients undergoing chemotherapy, or transplant recipients, are more vulnerable to developing active TB. Even those with previous exposure to TB may have a latent infection that reactivates if their immune defenses weaken. Now let's cover the methods used to diagnose TB.
TB diagnosis begins with the Mantoux tuberculin skin test, also known as a PPD test. PPD stands for purified protein derivative, which is a solution derived from dead TB bacteria. This PPD solution is injected under the skin, and after 48 to 72 hours, the injection site is checked for induration, a firm, raised bump. For the general population, an induration larger than 15 millimeters indicates a positive result. For healthcare workers and others at higher risk, 10 millimeters is positive. For immunocompromised patients, even 5 millimeters is enough to indicate exposure. If the skin test is positive or inconclusive, a chest X-ray is used to check for granulomas. To confirm active TB, we collect 3 consecutive early morning sputum samples to test for Mycobacterium tuberculosis. If all 3 results are negative, the patient is no longer infectious. 3, and you're free. Now let's go over the clinical signs and symptoms that suggest active TB.
When TB becomes active, it causes several classic symptoms. A persistent cough lasting more than 3 weeks is a major red flag, especially if the patient develops hemoptysis, or blood-tinged sputum. Night sweats and unexplained weight loss are other key indicators. Patients with active TB may also experience fatigue, fever, chills, and shortness of breath due to lung involvement. Anorexia, or loss of appetite, contributes to further weight loss. Recognizing these symptoms early is crucial to initiating prompt treatment and controlling the spread. Now that we've covered the symptoms, let's move on to the medications and treatment protocols for TB.
Treatment for TB involves a combination of 4 medications called the RIPE regimen, taken during different phases. In the intensive phase, which lasts for 2 months, patients take all 4 medications together. Rifampin. This medication causes body fluids, like sweat, tears, and urine, to turn red or orange. Patients are advised to switch to glasses instead of contact lenses and use non-hormonal birth control, as rifampin reduces the effectiveness of oral contraceptives. Isoniazid, INH. This drug can cause peripheral neuropathy, numbness or tingling in the hands and feet, because it interferes with vitamin B6 absorption. To prevent this, patients must take B6 supplements daily. Pyrazinamide. This drug targets dormant bacteria, helping to shorten the treatment duration. Ethambutol. Patients need regular eye exams because this drug can cause blurred vision or color blindness. After the 2-month intensive phase, patients enter the continuation phase, which lasts 4 to 7 months. During this phase, only rifampin and isoniazid are continued to ensure complete eradication of the infection. The entire treatment lasts 6 to 12 months, depending on the patient's response. It is critical that patients complete the entire course to prevent multi-drug resistant TB. Since all these medications are hepatotoxic, harmful to the liver, patients must avoid alcohol throughout treatment. Regular follow-ups are essential for monitoring progress and ensuring successful recovery. Now let's take a look at how TB is managed in healthcare settings to prevent transmission and support patient care.
Managing TB involves implementing strict airborne precautions to prevent transmission. Patients with active TB must stay in negative pressure rooms to ensure infectious particles are contained. Healthcare workers need to wear N95 respirators, and if the patient leaves their room, they must wear a surgical mask. The I-cough protocol is used to support respiratory health. I. Incentive spirometry. C. Coughing and deep breathing. O. Oral care to prevent infection. U. Understanding through patient education. G. Get out of bed to encourage mobility. H. Head of bed elevation to ease breathing. Patients are most contagious during the first 3 weeks of treatment, so it's important to test family members and close contacts for TB. Educating patients on the importance of completing the entire course of treatment is critical to preventing multi-drug resistant TB. Now, let's summarize everything we've covered.
Tuberculosis is a bacterial infection that spreads through airborne transmission, primarily affecting the lungs. Diagnostic tools include the Mantoux skin test, chest x-rays, and sputum cultures. 3 and you're free. Treatment with ripe therapy lasts 6 to 12 months, and completing the course is necessary to prevent multi-drug resistant TB. The key symptoms to recognize are persistent cough, hemoptysis, night sweats, weight loss, and fatigue. Nurses play a vital role in ensuring proper infection control, educating patients, and monitoring for side effects such as liver toxicity and vision changes. With adherence to treatment and proper precautions, TB can be effectively managed and controlled.
You gotta give him that huck too and spit on that thing, you get me?